Instead of devoting his time and effort to taking this pandemic seriously, President Trump is hosting campaign rallies, packing thousands of people tightly together without masks, in direct opposition to the guidance of all public health experts, just so that he can hear the crowds chant his name. Clearly, this president has decided the best strategy to deal with the greatest threat against this country during his presidency is to bury his head in the sand and wish it went away. Dr. Redfield, as the director of the CDC, your advice to the president is important now more than ever. Dr. Redfield, when was the last time you spoke to the president about the country's response to this pandemic?
Thank you, Congresswoman. As I mentioned before, the interactions and discussions I have with the president, I'll keep to myself, but I do meet with the task force.
Dr. Redfield, I'm not asking for the content of your conversation. I'm asking when you talked to him last. It's been a week, a day, a month?
Again, I'm going to stay with my same answer that I continue to talk with the task force whenever the task force meets. And I think
Thank you, Dr. Redfield. I think the fact that you won't tell this committee when the last time you spoke to him, whether it was days or months ago, is a real concern. Dr. Fauci, when is the last time you spoke to the president?
About 2.5 weeks ago.
Thank you, Dr. Fauci. Admiral Shawal, when is the last time you spoke to the president?
It was about 2.5 weeks ago as well, maybe 3 weeks ago. If you don't mind just me clarifying, because I do think it's really important, I'm remaining the testing lead. A lot got misconstrued because I said I was not going to be 100% of the time at FEMA, because my current position also works on ending HIV substance use. So I'm still going to maintain the testing lead, but I am also integrating back into some of my other office functions.
Thank you for clarifying that. Honorable Hahn, when is the last time you spoke to the president about the pandemic's response and the response?
It's been some time since I spoke about the pandemic response. I did have a conversation in the last couple of weeks.
Would you say that it had been more than a month ago?
No, ma'am.
Okay. Dr. Fauci, you've been candid in the past about the shortcomings of the federal government's response and what more is needed. Dr. Fauci, as painful as this spring's shutdowns have been, if we don't put in the effort now, expand testing, prepare for a second wave, develop national strategies for contact tracing and vaccinations, could we see our progress reversed? And could we be forced to shut down again if cases again get out of control?
In describing what's going on, it's a very complicated situation and a mixed bag. There are certain parts of the country, certain areas, cities, states that have actually done very well and are following the guidelines that we put together. The gateway, phase 1, phase 2, phase 3. New York City is one of them. Actually, Washington, D.C. is another. There are other areas, other states, other cities that have not done so well. I have a considerable concern about those because I want to make sure that we get everything under control. It is not there yet. I hope as the weeks and months go by, we will be able to do what you're referring to and mobilize the identification, isolation, and contact tracing in those states, the ones that have recently been in the news, Florida, Arizona, Texas, and those states that are now having a serious problem. So it really is a mixed bag. We have some doing really well and some really in trouble.
Right, but Dr. Fauci, just to clarify, in the areas where it may get out of control, we certainly know there are states that are doing that now. Would you say that we might have to go backwards and some of the progress may be taken away and we may have to shut down?
Yeah, I wouldn't necessarily, first of all, I agree with what you're saying. I wouldn't necessarily say an absolute shutdown, lockdown.
Right.
But if someone is going from gateway to phase 1 to phase 2, and they get into trouble in phase 2, they may need to go back to phase 1. I don't think they necessarily need to go back to lockdown.
Thank you. Thank you all. With that, I yield back.
Thank you. Now we go to Delaware. Ms. Rochester, please unmute.
Thank you, Mr. Chairman, and thank you so much to the panel. We know that under normal circumstances, when uninsurance, health insurance, the lack of that, as well as the underinsurance of individuals is a big problem for our country. But right now with the current pandemic and the high unemployment rate, it's an absolute crisis. I don't want to turn this into a debate about the Affordable Care Act or Medicaid expansion or any other policy disputes that we may have. The fact remains that millions of people in our country are either without health insurance or they can't afford to use it. And they are especially vulnerable right now. There are close to 30 million people without health insurance in this country. And for those people, it will undoubtedly be harder to receive testing and treatment. And when a vaccine is developed, they will likely struggle to access that vaccine. Dr. Fauci, as a matter of public health, would you agree that during a pandemic such as COVID-19, it is in everyone's interest for people to be quickly tested, treated, and ultimately vaccinated?
I agree.
And Dr. Fauci, if approximately 30 million people in this country can't easily access treatment and vaccines because they lack health coverage, doesn't that present a public health risk?
I feel as a physician, a scientist, and a public health official that everyone should have access to the kinds of things that we're talking about, testing, as well as accessibility to a vaccine and healthcare.
Admiral Giroir, the administration has suggested that money from the Provider Relief Fund, which is supposed to help struggling providers, is how it will pay for care for the uninsured. When can we expect a comprehensive plan from this administration for how it plans to provide treatment and vaccines to people regardless of insurance status?
The vaccine plan, I think, is currently underway, as you heard Dr. Redfield do that. I work very closely with HRSA on making sure that everyone can get free testing. That program is underway, and the claims reimbursement for treatment is up to about $186 million now. So I know that's ongoing and would be glad to have HRSA or anyone else answer any specific more questions that you would have. But I do agree with the premise, again, that it is absolutely critical, not only in a pandemic, but under any other times, that people who need testing get their testing, that they get the health care that they need, and most importantly, there are no impediments whatsoever to getting vaccinated.
I don't know if anyone on the panel could answer this question, but were there conversations about expanding Medicaid or opening up enrollment for the ACA to actually mitigate the risks?
So I'm just going to say that I am not a member of the task force, but am at most of the meetings as an invited guest for obvious reasons. And I think there were discussions across the board about all options. All options were looked at and discussed in order to make it was clear that the objective needed to be that no one should be waiting at home in need of care because of a lack of coverage. And I would say that every option was really looked at, and the leadership, the administration at the White House decided on this way to move forward.
I will reserve my comment to just say that I think those options would have been no-brainers. I champion legislation included in the HEROES Act that would require insurers to cover COVID-19 treatment with no cost sharing. And the HEROES Act also included a provision that would provide coverage of COVID-19 treatment and vaccines to Medicaid for everyone who's uninsured. I sincerely hope our colleagues in the Senate will take up the HEROES Act so that we can make sure that everyone in this country can access the treatment and vaccines they need. I yield back the balance of my time.
Thank you. Next is Mr. Soto of Florida. Please unmute.
Thank you, Chairman. I want to go through a little bit of a timeline. On January 23rd through 28th, President Trump received 2 intelligence briefings on the coronavirus, according to White House officials. From early January well into mid-March, President Trump deliberately misled the American people into believing the coronavirus was, quote, well under control. He declared on several occasions, quote, it will disappear. And as late as March 12th, he stated, quote, it's going to go away. The very next day, on March 13th, he finally declares the national emergency. Approximately 50 days passed from the time President Trump received his first coronavirus intelligence briefings until he finally declared the national emergency. Add in 6 weeks we lost in ramping up testing at the CDC due to contamination, and the results of President Trump's disastrous response have been deadly. The United States has more COVID-19 deaths and more cases than any country in the world. Over 120,000 Americans are dead. 2.4 million Americans contracted the virus, and the economic fallout has left 43 million Americans out of work. To argue that President Trump's response has somehow been a success is really quite astounding. It's our job to conduct oversight and hold the administration accountable regardless of regardless of your party. So moving forward, Dr. Fauci, the House has already passed the HEROES Act, which includes $75 billion in additional coronavirus testing, contact tracing, and isolation measures. How important is this funding to our continued efforts to combat COVID-19 in the United States?
Thank you for that question, Congressman. As we have said throughout this hearing, clearly testing, even more widespread testing on a surveillance basis is absolutely essential for us to really get a full understanding of the penetrance of this, particularly among individuals who are asymptomatic. So the short answer to your question, it's very important.
Thank you. And Dr. Fauci, how important is this additional funding to stop recent increases in COVID-19 cases as seen in my home state of Florida?
Again, in tune with what I just mentioned, the more that you understand the dynamics of the infection, the more that you understand the distribution, the more chance you have of better control for identifying, isolating, contact tracing, and concentrating the resources in those areas where you have the most problem. You won't know that unless you know exactly what the penetrance is in your community.
Thank you. Commissioner Hahn, there's a shortage of remdesivir in Central Florida in and around my district. Will the FDA be able to assist us with this shortage? And have we seen other shortages of remdesivir across the country?
Sorry, Congressman, really appreciate the question. We are working closely with HHS as well as the White House Coronavirus Task Force, who are responsible for the distribution of remdesivir. We do know that we have a supply in this country, and I am very happy to work with you and with others. So we're glad to have our folks get in touch with yours to make sure that there's adequately supply for Central Florida.
Thank you, Commissioner Hahn. Dr. Redfield, we saw after the nation, we lost 6 weeks in ramping up testing. And now, do you think that the United States' relationship with the World Health Organization is important to the future of combating the coronavirus, both in the United States and worldwide?
Thank you very much, Congressman. We continue to have an important public health relationship with the WHO. We've had a long history of partnership with them. We're currently involved in a number of very important public health efforts, eradication of polio, responding to the Ebola outbreak in the DRC, developing our influenza surveillance system across the nation. So we continue that a partnership at the scientific and public health level.
Thank you, Dr. Redfield. And so it's going to be very important not to defund the World Health Organization since it's for our national interests. And with that, I yield back.
Thank you. And last but certainly not least is Mr. O'Halloran.
And that always brings a smile to everybody's face, Mr. Chairman. Members of the panel, thank you for being here today. I'm going to start out with a forest fire. I've been to 3 of them last week because my district has 8 going on right now. And when I get to an incident control meeting, the commander of that incident control team is there, and then the division managers for that fire are all there too, or on the phone. and being able to address the issues, as are all the community organizations, police, fire, emergency response groups. They're all on those meetings, and there's multiple meetings during the course of the week with the citizens of those communities at risk. And now I'm in a process where I'm trying to figure out how this whole process working from the standpoint of, we're here now, what's happened, we can't change that. But going forward, how are we going to address that we have enough of the testing equipment and not training equipment, the tracing equipment, in order to address the issues potentially in October, November, and into the winter? How are we going to, or will we have, a command and control system that doesn't include 50 people doing whatever they want to do, and not any ability to react to hotspots as they occur as quickly as they should, maybe? And are we going to be ready? Hotspots. I have Navajo is my district. I have a White Mountain Apache in my district. White Mountain Apache, over 1,500 have gotten the virus. That's out of 12,000 people. Navajo, the whole nation knows what happened on Navajo. It took us weeks to get enough help up there to be able to address that problem. And White Mountain Apache are still calling me all the time saying, where is this and where is that? So it's obvious that we have a shortage right now. How can we be guaranteed that we're going to have the necessary equipment and materials to be able to address it coming up during a flu season and the pandemic at the same time? And then transparency and accountability. I don't know how right now you trace transparency and accountability in this system, because it's almost impossible. Because nobody says, that was my fault. So, and I think every one of your groups has done an outstanding job. I just can't find out what you're doing on a regular basis. I hear something on the news, but that doesn't mean that I really end up knowing what it is. And so Dr. Fauci, could you explain to me where we are at now, and how are we going to attack these hotspots and address all the issues I just talked about by the fall? And will we be prepared? And I guess most of all is the entire process of, how do we educate the public that has different ideas and concepts right now to be able to understand the complicated nature that all of you have addressed here today, and the overwhelming need to cooperate with one another as America always has? Dr. Fauci.
You asked a lot there. I'll try to be succinct in my answer. So where we are now, as I mentioned a little bit ago, that it really is a mixed bag. It's a big country. It's very heterogeneous, and you can't have essentially a unidimensional approach to the difference between Arizona and the things you're responsible for and New York City metropolitan area. Some areas have done very well, are well controlled. They're going through the guidelines to open America. Others that we've discussed in detail today are doing poorly, and we're very concerned about them. So you're talking about, what about as we get into the fall and the winter? The first thing that we would need to do is to try as best as possible to get the complete outbreak under control, so that everything is at such a low level that when there are cases that come up, you can contain them, as opposed to mitigating, where you're essentially chasing after a forest fire that you just mentioned. Hopefully, we'll get that under control soon. The other thing we need to do is to get the material, which we are doing, and Admiral Giroir, I'm sure, will comment on that, because he's done a phenomenal job of doing that. Getting the PPE, getting the ventilators, getting the equipment that we need, and have them in store, so that if, and I hope it's if and not when, but if we ever need them, we'll have them and not be in the situation that we were in February and March.
Will we have them by October and November?
Yeah, I believe we will. We certainly will have the testing that we did not have early on. We will have it by October. With regard to the other things, the PPEs and the others, perhaps Admiral Giroir can help you with
Thank you again. And again, this is what we spend all our time working on under the cooperation with Department of Defense, FEMA, HHS. We've already talked about testing, and if you want a person with accountability, it's me. If we don't have it, you look at me, it's my problem. But the whole testing infrastructure is really working together. The laboratory supplies, the laboratory testing, the NIH program, the BARDA program is all working in synergy, and I'm coordinating all that to make sure it happens. In terms of PPE, we had a long way to go because almost nothing was made in the United States. I mean, literally, almost nothing was made in the United States. I mentioned earlier that a good example would be the N95 masks, and Admiral Polubchek tells me as a result of everything, we're going to have about 180 million per month made in the United States by the fall. That's ramping up very quickly, so we feel pretty good about that. And ventilators were just a good success story. I worked a lot on the ventilator problem early on. I'm an intensive care physician. That's probably the only thing I do best is work with children on ventilators. But we were very concerned about that. And by July, we'll have about 50,000 in the stockpile. We only had 19,000 to begin with, but we'll have 50,000. So we know we're going to be in good shape for that. And I'm going to use a word of Dr. Fauci. I'm cautiously optimistic, but I am very cautious, and I still don't sleep well at night because we have a long way to go. And I just want to make the point that everyone has made. It's not like this is all going to happen to us. The American people have a lot to say about this, and we want to emphasize following the guidelines, following the phases, avoiding mass gatherings, wearing these things, using hand hygiene. We have a lot to say about where this is going to go, but we all need to continue to work together to make that happen.
Thank you, Admiral. And I yield.
Thank you. Let me thank all of you for bearing with us for 6 hours, I guess, and a really thorough analysis of what is going on. So I want to emphasize again, we really appreciate your being here and your thoughtful responses to everything. Thank you so much. And I'm going to let you go because I have a long list here of documents to read for the record, so you don't have to stay for that. But thank you again. I want to remind members that pursuant to committee rules, they have 10 business days to submit additional questions for the record to be answered by the witnesses who have appeared. And I ask each witness to respond promptly to any such questions that you may receive. And we would like to insert in the record by unanimous consent the following documents: a letter from the American Society of Microbiology to the committee dated June 23rd, 2020, a letter from the Alzheimer's Association to the committee dated June 23rd, 2020, a letter from AFSCME to the chairman dated June 23rd, 2020, a letter from the American Society of Hermatology dated June 23rd, 2020, graph from Representative Olson on COVID-19 cases in the Houston area, a statement from Representative Burgess dated June 23rd, 2020, and a letter from Ranking Member Walden on Committee Rule 9B1 dated June 23rd, 2020. And I'll repeat again that any member that wishes to submit a opening statement for the record is certainly encouraged to do so. And with that, at this time, the committee is adjourned. Thank you to everyone. Do I have that drug? Do I not? Do I, since you came for 6 hours, do I have to wait a period of time before I call you?
At least an hour. Okay. I need an hour to stretch out a little bit. You can call me anytime.
Thanks, tomorrow.
All right.